Alrighty. Well, hey y'all. We are doing our daily shenanigans today, and today is about vaginas. Okay, that's what we're here to talk about. We're very excited. We have a special guest with us. Okay, Dr. Celestine here with us. She has her own podcast about vaginas, and she's a gynecologist, and we are so happy to have her with us. I guess you can tell them a little bit about yourself and like how you got into gynecology, how you got into podcasting, all the things.
Yeah. Hi, guys. I'm Dr. Celestine. I have the podcast called For Vaginas Only that I've been doing since 2017. I got into it because there was a lot of misinformation and lack of information when it came to women's health that I was seeing kind of every day at my job. And I felt like people were going more towards social media, looking for information, and there needed to be reputable sources out there. So I decided to become one of them. I've been a gynecologist since since I was training would be 2011. But I've been kind of on
Okay.
my own since 2016, and I've been working all over. I currently work in New Jersey taking care of women, and it's great.
Okay. Well, is there like any type of like specialties in gynecology? Like you specialize in I don't know, a different type of people, vaginas, I don't know.
So there are specialties, but I'm a general obstetrician and gynecologist. So I deliver babies and I do
Mhm.
general GYN. You can go into specialties. So if someone has more of a bladder problem, there's a urogynecology specialty for that. If
Mhm.
someone has a cancer problem with their vagina, there's a specialty for that. And then there's like the REIs, they do in vitro fertilization, things like that. That's a specialty off of gynecology as well. But I do general obstetrics and gynecology. So that's my field.
Okay.
Okay. So you mentioned like people come in to you and they say things and you're just kind of like, this is information. What is something that's like, I guess kind of weird, but a lot of people think that's wrong, I guess? Like something you get the most often.
Mm, I mean, one thing I would say the most common thing that I see in my office is that people have seen other gynecologists and they have gotten dismissed before when they have like
Mm.
a real vaginal problem. I mean, that's not like crazy, but I think that's the most common thing I've seen. And then the one that's probably crazy is people coming in kind of talking about weird treatments that they've seen, like putting mayonnaise on their vagina for this, or even the apple cider vinegar treatments that are out
Mm.
there for a lot of different things. That doesn't work.
Yeah.
Like there's a lot of
The
random things
baths.
that people come in,
Yeah.
they're like, well, I have this problem and I've done XYZ and everything. I'm like, okay, yeah, you definitely saw that on TikTok. I'm
Mhm.
like, that's not gonna work. Let's talk about what works.
Yeah.
Yeah. Yeah,
Yeah.
TikTok is
It
definitely
can
the
be a
main
slippery
source.
slope. Yeah, like
Yeah.
it can be very quick to be like,
And I'm
"Say
not saying you
what?"
can't find good stuff on there because you can,
Mhm.
but you really have to be careful.
Yeah,
Yeah. Yeah.
definitely. Apple cider vinegar sounds dangerous, but
Yeah, yeah, yeah.
I guess
It's
the
just
girls do it.
the girls do a lot out here. There's a lot that people are doing.
Right. Gotta try it once, I guess.
Yeah, exactly.
Yeah.
I'm like, I guess if it
I
doesn't
guess.
hurt you, might as well try. But yeah,
I guess then they have to go to a doctor, and then they're like, "Wow,
exactly. Then they come to me.
tragic."
I'm like, welcome. Let's talk about it.
Mhm.
Why did you do that?
Yeah,
Yeah,
Yeah.
yeah. That's usually how it goes. Yeah.
I feel that. I'm a home remedy person. Not all the time, but sometimes I'm just like, maybe let me try first. And then I'll go over there and then I'll just be like, okay, well, I'm gonna have to hand it off to the professional because I tried. But I do try a little bit.
I get it. I mean, it's sometimes it's hard to get into your gynecologist in time. Sometimes you don't
Mhm.
have time, so you just want to like pick something up. So I totally get it. I wasn't a gynecologist my whole life. I was also
Right.
Yeah.
out there trying to figure things out too for a little while. So I get it.
Mhm.
So, like, why do you think, like, I guess having a gynecologist is like super important then? Like,
So
since it's kind of hard to get into, or like
yeah,
not the most common doctor that people tell you about, I guess.
well, people don't want to talk about it, because
Yeah,
they
for
think
sure.
it's taboo, which hopefully we're starting to break that stigma. But
Mhm.
I think it's important to have a gynecologist because you need somebody that you can trust to talk to about your problem. So the one thing I always tell people is, you know, you may not even like me, but you need to find somebody that you gel with, somebody that you like, somebody that you feel comfortable telling your deepest, darkest secrets to,
Mm.
like the most crazy nonsense that's happening to you, because you need somebody to guide you in the right direction, give you the right answer. So it's important to have one. You can't just rely on your parents, because I see your parents too, and they're doing some things wrong. You know, you
Right.
can't rely on the internet. You can't rely 100% on friends, and everybody is different. So even if it worked for your friend or your mom, it might not work for you. So you really have to talk to a doctor that you get along with and feel comfortable with.
Mhm.
It's important for every female to have one.
Yeah, I agree. Because my mother, love her. But was she really was she really telling me all the things I need to know about my vagina? No. But granted, I don't even think she knew all the things that she
Right.
needed to know. So yeah, definitely getting a gynecologist and like, doing my own research was very helpful. Like growing and stuff, I'm like, girl, what's going on? Like I just don't know what's going on. I don't know what's good, what's bad, what needs to be attended to, what will come and leave. Like I just do not know.
Or come and stay. Yeah.
Right, exactly.
Yeah.
What's gonna last? Like, all
Yeah.
this stuff. So, yeah, definitely getting a good gynecologist. I'm really good at any type of doctor. I'm just gonna tell you the truth because I'm paying to be here. Let me just let you know. I've done this, that, the third. I've done this, because there's no point in me lying to you. Like, I'm paying to be here.
There is no point. And I mean, I'm going to be very polarizing here, but I hate when people lie to me. Like, I can't help
Mm,
you if you're not telling me the truth. So just tell me. I promise you, I've heard it before. So just tell
right.
me the truth and let me truly help you. So, yeah, telling the truth is super important. Yeah. Mhm.
Definitely.
Yeah.
For
Definitely.
sure. Yeah. I don't think I've been to a doctor and lied yet. So I think I'm doing good so far.
Yeah. I like
I have to
that.
think about it.
Kudos to you. Good job.
Okay.
Okay.
Well, I guess going into like, I guess, problems and things that people don't know about, what are like, I guess, the most common like vagina problems? Because I feel
Yeah.
like most people don't talk about, I mean, like the UTIs and I don't know if that's common, but I'm just gonna say the ones I know off the top.
I feel like people say that a lot. UTIs or yeast infections, BV. What else
There you
is
go.
there? Yeah, I listen through process of elimination, you realize BV and yeast infections are not the same thing.
Right.
And nobody talks
Oh,
about
whoa.
BV. Everybody talks about yeast infections. Then you get BV, then they're like, oh,
BB
this is
has
BV.
BB has such a stigma. So I'll say like the top
Yeah.
three things I see are one, BB, two, yeast, which is interchangeable with one and two, truly.
Mm.
And then three is something a little weird. It's called lichen or lichen sclerosis. There's lichen planus, lichen simplex chronicus. So I just call them lichen to kind of simplify it. So
Mm.
kind of talking about BV and yeast, I think BV has such a stigma because everybody like doesn't want the fishy vagina odor, and even like my guy friends will talk to me like, oh, I was with this girl and her vagina smelled like XYZ. I'm like, listen, part of the problem is probably you.
Mhm.
I'm like, so
Yeah.
you need to stop with that and tell the girl she needs to get some treatment and stop stigmatizing her.
Mhm.
But BV and yeast are super common. So BV is kind of like that fishy odor of the vagina. You kind of have a little discharge, but it's only like slightly itchy, not super itchy. That's usually BV, and that's really common. And then yeast infections are kind of like a thick white discharge that you see, and it's really itchy. So really itchy on the outside, like the vulva, and then also itchy on the inside of the vagina. So I would say those are like the top two most common, and those are treatable with medications. Some of them are even over the counter, like Monistat for yeast infections. So there's
Mhm.
treatments for those things. I would say if you have a really mild case, some like over the counter things might work, but sometimes you need a doctor for a more severe case of it, especially if you have it chronically. Like some women get it all the time. Some women get BV every time they have sex or every time they have sex with a certain person,
Mm.
or a yeast
I heard
infection.
about that.
Yeah, or yeast infection every time they take an antibiotic, or they're out swimming, or it's like the summer, they're sitting in a bathing suit. So those are really common. It's kind of hard to treat the chronic ones, like the ones that get it constantly. We have to try a bunch of different things. Like I always tell people if they get them a lot to try probiotics every day because that helps. Like the vagina and the anus are really close together. So a lot of like the same bacteria can intermix in certain people. So I always say start with like a daily probiotic if you get them all the time just to see. But those are the two most common. The third thing is lichen. Lichen is interesting. Lichen is almost like an autoimmune condition. If it's lichen sclerosis, for example, it's something that comes up all the time, and it's like the outside, like the vulva, become really itchy. You don't have an STD, you don't have BV or yeast. Sometimes you see like a change in the color of the skin, or sometimes you don't, and it's just like always itchy. Sometimes we have to biopsy the vulva in order to figure out that that's what's going on. But it's really common in young women and older women. It kind of has two age groups. So yeah, and that has a treatment too. It's something that doesn't go away completely, but we can manage it.
Okay, well, learned something new. I never heard about
I know.
it.
Right.
It's really common though. Yeah.
Like, so the people, they usually can like recognize it like when they come to the gynecologist, or it's like, oh, this is something that just happens to me, and you're like, oh, maybe it's this.
Yeah, they usually don't know by the time they come to me.
Okay.
They've been treated for yeast probably a million times and it doesn't really fully go away or help them. They've gone to probably a handful of gynecologists. No one biopsied them before, or sometimes they give them the treatment, but they don't really tell them what's going on or to expect it to come back because it's a chronic problem. So yeah, I would say it takes a few tries before you find the gynecologist that really kind of knows about it, that's looking for that. Yeah, which is unfortunate, but you know, it happens.
Yeah. Well, let's talk about periods because because I just have so many questions about periods. Like I'm now 25 and my period has gone. Well, I've been on like a couple different birth controls. I've been here, there, and everywhere throughout from like 18 to 25. But also I've just seen, even without birth control, because I've been off that for a while, I've just seen like fluctuations in the way my period is depending on like how active I am, what I eat, all that kind of stuff. And I'm just so curious, like, why is that? Like, why are periods the way they are? Like, why do they change and stuff? Because people tell you you're gonna have a period, it's gonna come once a month, but they never tell you like, oh, it might be heavier because you're older, or it might slow down and all that kind of stuff. So like, what's the deal on those?
So periods are truly just the shedding of the lining inside the uterus, and they're supposed to be once a month. Like, let's talk about normal. So it's supposed to be one time a month without any bleeding in between. It's supposed to last anywhere from like 2 to 7 days. And it's not supposed to be super heavy where you're filling up a pad or super tampon every hour consistently. So if it's if it's kind of in that normal range, then you're good. But as you get older, your periods change. And that happens for many different reasons. So sometimes there's things that actually grow in and on the uterus, like fibroids, if you've ever heard of those, which are pretty common. About 80% of people have those. And polyps, sometimes polyps grow. It's like a benign kind of like extra fleshy tissue inside the uterus. Those can grow in there too, which can change your period. And all of these things can happen as you get older. People start having children and then their periods change again. So, you know, the period can change all the time. I would never say that. It's really rare that I have somebody that says my period's been the same my entire life.
Yeah.
So there's so many things that can change it. I mean, I have a few podcast episodes on that, but it can go on and on and on. But I would say if your period is too heavy, if it's more than 7 days, then you need to talk to somebody. And you might not want, like, the first medication they try or the first treatment they try might not work. You sometimes have to keep trying different things to figure out what works for you.
Now, is there a way to change it? Okay. If it used to be light, now tell me you want it to be light again. How could you, is there a way to manipulate it, or it's just like you're getting what you get?
No, I mean, if you can take ibuprofen, sometimes that can help to lighten your period. So that's kind of an over-the-counter thing. You know, as a gynecologist that practices Western medicine, I'm very into like the actual pharmaceutical drugs. So when it
Mhm.
comes to birth controls, they can all change your periods in different ways, usually for the better if you find the right one for you.
Mhm.
But I do also believe in diet changes and things like that. I mean, I just don't practice that type of medicine. But there are like naturopaths out there, people that have actually studied to use herbs and to done like clinical hours and things like that to kind of help you out with herbs, because herbs are how medicine started, right? So
Mhm.
Yeah.
that's definitely out there. I just can't say, I'm not the one to really speak on it. So I do know a couple people in my area. So if patients come to me and they want a more natural way of doing things, and I have some people I can refer them to. But for me and what I practice, I would say birth control is kind of the go-to in terms of helping people with their periods.
See, yeah.
Okay.
Yeah.
You know what? I might have to look into the natural stuff because honestly, when I was on birth control and then I missed a day, and at
Mhm.
the time my period was like 6, 7 days. So I had
Mhm.
it for like 2 weeks. I never
Mhm.
took it again. I was
Okay.
done. I was like,
Yeah.
I was hurting inside. I was like,
Yeah. As soon as you
so
Mhm.
miss a day or you're late, it throws everything off. You kind of have to kind of start
yeah.
from the beginning again. Because it's all about birth control is kind of not manipulating, but regulating your hormones. So instead of the cycle kind of being up and down and up and down, it keeps it a little bit more stagnant and a little bit more in a straight line in terms of a hormone fluctuation. It fluctuates less. So if you miss that, your body kind of wants to go back to its old way. So it takes,
Mhm.
a few days of restarting the birth control in order for it to come back. So that's why that happens. Yeah. It's
Yeah.
annoying. I mean,
It came quick.
I know.
Okay.
It is
I
annoying.
was
Same
hurting.
thing happened to me.
Yeah, I've been on birth controls too. I've tried a lot of them. It is for some people and it's not for other people. So
Mhm.
everybody's got to find their thing. But there's ways to help you. So I would say if you are suffering with any period problem, you don't have to deal with it. And also don't think that it's normal. So many people think, oh, my period's been heavy my whole life, or oh, my period's
Yeah.
been painful my whole life. Like, no, that is not normal. It should not be that painful or that heavy. So like find somebody to help you.
Yeah, definitely.
Yeah.
Is it true, like when you spend a lot of time with someone that your periods sync up, or is that like a myth?
Um, it's so there's no real science behind it that I'm aware of,
Mm,
but have I seen it happen? Yes. So I'll say kind of a little bit of both when it comes to that. Yeah, but I
Mhm.
haven't actually even ever read any studies or anything like that about like
yeah.
period syncing. And I work in an office with a bunch of females, and I know that we don't have our period at the same time. So I can't say it happens all the time. Yeah.
True.
Okay, cool.
Yeah.
Cool.
Yeah, I feel like that's happened to me before. Like
Yeah.
different things I've done, like with groups of women, I'm like always with them. By the end or like a couple months in, I'm like, all of us are here at the same time. That's interesting.
I know. I know. That
Yeah.
thing. I'll look into that a little bit actually. I wonder if anybody's actually studied that. But yeah.
Yeah, somebody should.
Right.
Mm-hmm.
So
Yeah.
how do you feel about all the different I guess types of like period things that people use to not necessarily stop their period, but tampons and all that kind of stuff. Because I know there's been like an influx of organic tampons and pads and the flex pads or the cups, the diva cups, all this stuff that's supposed to be
Yeah.
better than tampons, better than the way we used to live when it comes to periods. Like,
Yeah.
how do you feel about that? What are some good options? Stuff like that.
Yeah. I will say that it's not a one size fits all kind of answer. So
Mm,
everybody that has a vagina has different types of sensitivities, different types of things that works well for them. I have people that have actually had reactions to some of the organic tampons and pads, and not the regular ones that we all know from forever ago, and
Mhm.
vice versa. I have a lot of people that have like allergies to the little sticky parts of certain pads, like when the lining or the liner or the pad turns up a little bit and touches the
Mhm.
vulva. People can get reactions to that. I mean, it's not a one size fits all. So the Diva cup and all those other cups, people like them too. But I will say the one thing about that is when blood kind of sits by your cervix, which is where it's holding the blood, it can cause more cramping of the uterus. So some people have felt like a little bit more like cramping and painful periods when they have those in, if they're susceptible to that. So really, I say just find what works for you. Nothing that's out there in terms of those products is detrimental per se. So it's not going to hurt you. You just have to figure out what works for you.
Right.
Oh, I think I was asking, is there any like truth to the regular tampons making your period last longer?
Not that I know of. No, I haven't really, I don't think that that's actually true. Like I said, I've had a lot of people have problems with the organic stuff as well. So I don't think so. I think sometimes people just change things or try new products at the time where sometimes something else is changing within them. That their period would have changed normally. Just like when people tell me that they've gained weight on the birth control pill, for example, like most people will gain a little bit of water weight that's temporary. But a lot of women start the birth control pill at the age where their body is starting to mature, and the weight gain is not always directly related to the pill. So I think it's kind of a circumstantial thing like that.
Okay, that makes
So
sense.
how do you feel about period sex? Is that like
I think
are
period sex
we
is fine. I don't think
okay?
it's against it. I just, I always tell people you can still possibly get pregnant with period sex, especially if you're doing it closer to the end of the period, because you could be ovulating shortly after that. So I would say that's kind of like a myth that as long as you're having your period, you can't get pregnant. But I think it's fine as long as you're comfortable with it, as long as you're not in pain, because that area is all a little bit more sensitive around that time. As long as your partner is cool, you're cool, then hey, why not?
Okay.
Yeah. Yeah. Why? What have you guys heard about period sex?
I don't know.
Oh, I do
Good and
think
bad.
everyone, huh?
I think you hear like positives and negatives.
Yeah, I think I think most people do think like you can't get pregnant because you're on your period.
Yeah, I heard that in high school too. I know, I remember that one.
Okay, but anything's possible.
Yeah, but the sperm lasts for 5 days. So sperm lasts 5 days in your body. So if you're at the end of your period and you ovulate like a little bit after that, which is when you create that egg that the sperm fertilizes, and it's chilling in your body for 5 days, it can happen. So you have to be careful.
Yep, gotta time it right.
Right. And this is the education we need. See, I'm thinking like, okay, in school, there's like, I don't know how many days I even spent in school talking about like vaginas or anything really sexual, maybe like a day or two. Like, I guess like if you had to like think about how long like we should have education in schools and when we should start it, like what we should be talking about, because like education in itself is lacking in that area. But
yeah,
like
I've even spoken like right before COVID. I spoke because I'm in New Jersey, like I said. So I spoke to the New Jersey school board because we're trying to not abolish sex ed altogether, which is, the vaginal health and the sex part, but they're trying to diminish it so much. They're trying to just like promote abstinence and, take out like graphic photos and they're calling it graphic, but like photos of actual anatomy of the penis, of the vulva, of the vagina. So I actually spoke to the school board about, trying to get them to stop doing that because we already don't have enough information.
Right.
So now you're trying to make it even less. Like, I just think that's crazy. How early it should start? That's so hard because kids are having sex and kind of touching their genitalia earlier and earlier these days. I think it has to do with social media, the internet, TV, but so it's hard to say when to start. I would think that question is probably better for like an educator and like the early education system because they see it day in and day out. I just have an almost 2-year-old, so I don't really that's like the only age group that I know really well right now. But I would say the earlier the better. You just can't use like don't scare them, kind of make it more about body positivity, embracing the differences in each person. And then as children get older, you talk about it more in depth.
Mhm.
I think it should have its own course, especially when I was in high school. We just had like, I think it was like 2 weeks of sexual education, and that's it. When I was like
Yeah.
15 or 16, it wasn't even like the whole high school curriculum. It was just for 2 weeks. So it's definitely, it has to be more than that. I think it should be its own course. It should be integrated into the school system, just like social studies and math. Um,
Mhm.
because, you know, there's those like topics and subjects are great too, but I'm with my body for my whole life. Sometimes I feel like I need to know more about that than
Right.
social studies
Yeah.
and math, depending on what field you go into in your life. So it should definitely be held with some sort of importance. And we're not doing enough right now.
Definitely not. Because my class, I think in high school, it was like kind of part of gym, like the gym classes would take you in to do
Yeah.
that. And we're talking about, it's like, oh, sex, drugs. This is the
Mhm.
concept. This is what we're talking about. I'm like, why are you teaching me about hookah right now? I don't really care about the cigarettes. Like, can we get into like the real? I mean, yeah, tell me, but like, we can move forward. Like, okay, don't do drugs. There, I got that.
Right.
But
Honestly,
like, let's
they
get
spent
more
a
into
long
it.
time on that. Like, they spent a long time on drugs, which I can understand. But it's like 2 days. Really feel like it was 2 days on sex, and they were like, "Don't chew tobacco." And I'm like,
Literally. Like,
okay, I won't.
abstain
Like,
from sex. I'm like, okay, it's not even about sex, it's about my literal body. Like, what's going on? What are some things that could happen?
Right.
What
People
can
come
birth
to
control
me, they
do?
don't know anything about their bodies. Even
Mhm.
older women that, when we're young, we think adults know everything. But, as I got
Right.
older, I realized like they don't even know everything about their bodies. And that's like a failure of many different systems. But, one of them is
Mhm.
definitely the school system in terms of educating us. So I completely agree. And, that's another big reason why I started my podcast too. I remember I saw someone once, like a much older lady, and she came to me because she thought something that was wrong with her like vulva and like genital area. And the reason she thought
Mhm.
it was something was wrong was because her pubic hair was gray. And she was like, I didn't even know pubic hair could be gray. Like once we got talking, she thought it was something that was
Mhm.
actually only wrong with her. And I was like, this
Okay.
has to change. Like
Mhm.
this has to change. Even like what I consider quote unquote simple things, which I know are not to the regular person, that's not a gynecologist. So that's part of the reason why I do what I do as well. Like even the smallest thing, even if I think it's small, I want to put it out there because I feel
Mhm.
like it can help somebody.
Yeah, most definitely. I think growing up, us now that we like got to grow up in the day and age where everybody telling their business, everything is everywhere. It alleviates some of that, like I'm the only one, because you're not the only one. You can, like you said, go straight on TikTok and find out real quick you are not the only one,
right, a whole
and
story
it just
time.
a
Yeah.
whole story time about exactly what's happening to you. You're like, wow, okay, this is
Yeah.
helpful.
Yeah.
So at least we have that on our side, and podcasts like yours,
Yeah.
podcasts like ours, really bringing it to the girls.
Talking like in a real way, I think is important. Like you don't want to
Mhm.
talk like you're talking down to somebody. Like even when I see my patients in my office, like yeah, I went through all this schooling, but you and I are still the two women living in New Jersey, trying to raise a family, trying to live our lives. Like let's talk at
Mhm.
a level that we could both understand. So I think just talking just like straight up with people about what's going on with them and about their health is the way to do it.
Yes,
Yeah.
most definitely.
Yeah.
All right. Well, I guess lastly, any tips and tricks, things that I mean, our podcast is a lot of women like us that listen. So, mid-20s, early 20s. Anything I guess they would need to know about themselves, their vaginas, you
Um,
know?
So I think, I mean, there's like a few things. So sometimes, like when I think about just like general vaginal knowledge and like general vaginal health questions, like the number one thing I try to tell people is to wear condoms. Like people lie out here. People will tell you they don't have an STD when they do, or they feel self-conscious about it. They want to bring it up because then that'll scare you. Even the most committed, let me not say that, but even the most, even the person that's telling you they love you the most,
Mhm.
if you are not comfortable with the idea that you could get something from this person, and potentially have it for your whole life, wear a condom. Like, it's fine. Don't let the boys pressure you. Don't let them pressure you saying it doesn't feel the same for them, or like sex is not the same with the condom. Well, you know what? My life is not the same with herpes. Like, so
Fun.
wear the condom. Okay. That's like the number one vaginal tip that I will give, because some women, you know, they get these things really early on in their 20s and it affects you for your whole life. It affects you sometimes in pregnancy, depending on what it is. So you have to think about the bigger picture, not just about the right now and the, ooh, that this guy is cute and yeah, I want to have sex, blah, blah, blah. You have to like protect yourself. So that would be like kind of the number one thing. The number two thing I would say, which I would say a lot of young women like that are probably listening to this don't do it as much, but if you listen to your mom or your grandma, you could. I've seen it here and there, but like, stop douching. Like, stop putting things inside the vaginal canal to wash it out. Like, whether you're telling me you're washing out old blood from your period or whatever, I don't care. No fluid in the vagina, none. Don't put any water in there, nothing inside. Just wash the outside, which is the vulva, with like a mild soap and mild soap and water. I usually tell people like the Dove Sensitive Bar. Once a day at least, you know, twice if you're showering twice a day, that's fine too, on the outside. And that's it. Pat it dry, keep it dry. Those are kind of like my biggest things for people. And then try the probiotic if you're having the chronic yeast infections and chronic BV. You try taking a probiotic every day, because I think those are the most common things I kind of talk to younger women about.
Okay. Real quick question.
Yeah.
Are you supposed to wear underwear every day? Like, are we?
So,
okay, right.
You don't have, I mean, do whatever you want, honestly.
Okay.
I always tell people to try to let it breathe a little bit. Because a lot of those things like yeast infections will grow because the vagina is really moist. So like, don't sit in wet underwear or a wet bathing suit for a long time. Let it breathe if you can. Don't wear these tight jeans all day long, you know? So I would say like skirts or letting it just kind of air out like for a few minutes a day can be beneficial for a lot of different things. Yeah. So you don't have to wear underwear if you don't want to.
So like, you're like affirming her. She's like, yep. That's
yeah, I knew it.
Yeah. I'm gonna keep going like this. Yeah.
That's funny. Well, thanks for coming. I think we're gonna wrap it up. You want to tell them, like, you know, you already told them your podcast, but like your handles, where they can find you.
So everything is For Vaginas Only, and that's FOR, vaginas with an S and then only. So my Instagram is at For Vaginas Only. My podcast is called For Vaginas Only. And you can email me at doctor, that's the full word, DOCTOR, C, the letter C, at fvonly.com. So those are kind of all the ways to reach me. Now, I can't give like direct medical advice to people because we can't do that via social media and things like that if you're not our patient. So any doctor that's kind of on social media will say that. But I talk about a lot of general things, a lot of common things that will relate to you. So you can see that on my Instagram mainly, and also on the podcast too.
All right. Well, thank you so much for coming.
You're welcome. Thanks for having me. It was fun.
Yeah, it was a good time.
Yeah, I actually did learn a lot, and you know, I had to get my questions in there. Been waiting all day for that underwear question, man.
Oh my gosh, you're holding on to that one,
right? I'm like, gotta get in there.
Yeah.
Can I wear it or not? That's funny.